my name is Jasmin Henry. Today I'm going to be talking to you about bipolar disorder and its effects on a quality of life. So despite a wide array of treatments currently available for this disorder, it continues to be pretty much a lifelong thing, with about as high as a 15% suicide rate amongst the patients. Patients also see a decrease in their life expectancy of about 9 to even 20 years. This is mostly because patients, while manic or depressed, don't make the best of choices. So they tend to develop things such as COPD, cardiovascular disease, diabetes type 2. They're actually, in fact, about 2 times as likely to develop heart disease. And this, of course, will take some time off of their life expectancy. The World Health Organization says that bipolar disorder is the 6th leading cause of disability. It's present in about 2.6% of the population over the age of 18. There is such a thing as juvenile bipolar disorder, but this statistic only accounts for those over 18, as I just stated. So the overall prevalence in the population, the entire population, is a lot higher. I've struggled with bipolar disorder since I was around 19. That's when it became the most noticeable. But I did actually start showing symptoms in my early teens, but it was just kind of pinned down to me being a difficult child. The real symptoms weren't very apparent yet. I was not officially diagnosed until late last year, at the age of 23, and I'm still 23 right now. Currently, I'm still balancing out my medication regimen. We are still trying to find a good balance. So I'm still learning to live with my disorder and all aspects of it. It has been very difficult, but I'm making the most of what I've got going on. So bipolar disorder affects all aspects of a person's life. Of course, quality of life is greatly diminished with this disorder. Usually impacts the work performance negatively, as well as social life. Most people with bipolar disorder tend to lose their social life because sometimes they're just too depressed to go out, or when they're manic, they tend to exhibit behaviors that people just don't want to be around them, so you tend to lose your friends. And you're very lucky if you do keep them. For the most part, you're kind of just left with your family or just yourself. So when people think of bipolar disorder, people usually think of like really crazy mood changes. People, when they're being indecisive, usually say things like, "Oh, I'm being so bipolar today," and things like that. And that's just not the case. It's an actual brain disorder. According to the National Institute of Mental Health, bipolar is, quote, "a brain disorder that causes unusual shifts in mood, energy, and activity levels, and the ability to carry out day-to-day tasks." That's one of the things that people tend to overlook. They think bipolar is just a thing that affects mood, and it primarily is. There's different episodes that people with bipolar can go through, and that also is dependent on the type of bipolar you have. For the most part, there's depressive episodes, mania, hypomania, and depressive episodes. For bipolar 1, you tend to see mania that lasts at least 7 days. Mania is usually defined as really, really extreme, happy, elevated behaviors, really risky behaviors. There can be some depression involved in bipolar 1, but it's not required for the diagnosis. Another diagnostic criteria of bipolar 1 is that a manic episode, would be severe enough to put you in the hospital. That would qualify you as bipolar 1. Bipolar 2 would be mainly depressive episodes that last minimum of 2 weeks. And instead of mania, there is hypomania, which is usually like a lesser mania. You don't do any of the crazy stuff that you hear about, like, jumping over cars or standing naked on your roof or anything like that. It's more small stuff, like you're very, very productive. You just want to get all this stuff done. You stay up late. You can't sleep. You talk very fast, very pressured. People can kind of tell you're off. Mostly the patient cannot tell that something's wrong. And that's why it's a lot harder to diagnose type 2, because they tend to not report the hypomania. The third type of bipolar is cyclothymia. That would be hypomanic episodes and depression that don't otherwise meet criteria for major depression or without mania. There's also the fact that there's a difference in the speeds of the mood changes. I am what you call rapid cycling, so I have a minimum of 4 or more episodes or changes, however you want to refer to them, a year. But there's people that change every few months, every few weeks. Some people are what they call ultra-radiant, which is they change every couple hours, so a few times a day. For the management, there's many different types of management. There's medications, such as antipsychotics. There are mood stabilizers. Mood stabilizers usually, people usually hear of lithium, but they use anticonvulsants that have mood stabilizing properties. I'm currently on Depakote. It is an anticonvulsant. I take it 3 times a day. And I have noticed some stabilization in my mood. While I still have symptoms, they are a lot more easy to deal with, but they're definitely still there. There is talk therapy, psychoeducation, kind of getting the patients involved in their own care and helping them be a part of their own care. For people that have not found any relief with the previously mentioned methods, there is electroconvulsive therapy, which people think is like really inhumane and crazy, but it's a lot better now than it used to be. And of course there will still be mood changes even with proper treatment. Some people see a great decrease, some people see a moderate decrease, some people don't, and that's when electroconvulsive therapy would come into play. A 2005 study by the International Journal of Psychiatry and Neurosciences found that, quote, bipolar patients experience lower functioning as well as well-being, even in the stable phase of the disorder. What this means is that even if you're not having an active change in your mood, you still have a lower functioning in your life. And this is because, while yes, predominantly bipolar is a mood disorder and it has mood symptoms, there is the fact that it has cognitive impairments. What this means for the patient is that they start to see a decrease in their abilities to manage their day-to-day life, keeping a schedule, doing daily tasks. I know I forget to do stuff all the time. I don't remember to take my medication. I forget my keys. I lock myself out of my car. I will put something down and immediately not know where it is. And it's really hard to see yourself like this because you're not losing your intelligence. You're still very much as intelligent as you were before, but you're seeing yourself deteriorate, and it's very frustrating, especially when you are, like me, a younger patient, and you should be more functional. So in conclusion, bipolar disorder is it's much more than mood swings. It's not just being a little bit sick here and there. You can't turn it off. You can't put it on pause for social situations. It's something that when it comes calling, and you can't say no. There's no shutting the door. There is no saying no. It will leave you in bed for days. It will have you spending $100 in 5 minutes. So that's why I think that education is important. To raise awareness, put it out there what this disorder really is, and when people get educated, they become aware. They are more willing to maybe donate money for funding for research, maybe better medications, more treatments, stuff like that. It's just a lot of people don't talk about this. They don't understand this disorder, and I did not choose to be sick with this, but I am choosing to educate people and be an advocate for my disorder. Thank you.